We also, for those who are listening to the podcast, they won't be able to see the screen at the moment, but it's just a really simple process for the Core Plus user community. They just simply enable the Cyber Clinic connection. There is a separate discussion that needs to happen. Qusai, do you want to talk us through what you would be suggesting or recommending for mental health practitioners who would want to engage directly with Cyber Clinic?
Yeah, so as you mentioned, the process is quite seamless. If they want to sign up to Cyber Clinic and make their sort of availability through Core Plus, they can certainly do that. So through the add-on, they need to enable that. And what that allows us to do is then be able to publish that so that the calendars sync with each other. But on the other hand, what needs to happen is that they also do need to register on the Cyber Clinic platform. And a very important reason for that is because we've now just completed our Medicare integration as well, where the rebates can occur automatically through the platform. But one of the requirements through that Medicare integration is that practitioners need to have a provider number specifically linked to the ID of that service. Otherwise, patients can't get their Medicare rebates, right? So that's a government requirement, and as a result of that, we do require all our practitioners to register on our platform and make their availability, etc., on the platform, which can automatically sync with the Core Plus platform. But once that happens and they register, they just need to go to www.cyberclinic.com.au. On our website, there's a practitioner page. All they need to go is just log onto that, put their details, and they'll automatically register, and one of our team will get in touch with them and then talk them through that process. And it's a very simple process of just setting up information, profile stuff that will allow the matching system to work better. And then once all of that is published and available, they then become available. Now, the beauty on our system is that what practitioners can also do is that they can make themselves available for the retail clients, which are basically those coming with a mental health care plan, or they can make themselves available for the different contracts that we have. So we have multiple contracts, and depending on what they would like to work on, or which areas they prefer, they can then make themselves available for those contracts. So what it allows us to do is help the practitioners really streamline what areas they want to work in, and then we add them to those particular types of contracts as well. The other really interesting thing, and a more recent development that we've had because of the demand, is we've also now created a feature on the platform where practitioners can set their availability to off so that they don't take on new patients. So that was a really interesting sort of development for us, and we had to work through the entire modality, because what we had to do was allow practitioners to switch their availability so that they weren't available for new patients, but continue to see their ongoing patients as well. And that's what we have a lot of our practitioners doing. And then so what they can do is when they feel like their books have opened up again, they just flick the switch, and then they are available to all the patients through the contracts and retail, whichever one they choose. So it's a very, very simple, seamless process for practitioners to manage their availability.
That's fantastic, and it's a very scalable model, Qusai. It's any Australian, in effect, whether they're coming through one of the B2B programs that you're running, or whether it's the B2C or retail, I think is the term that you used, client engagement. They're going to be matched and allocated to available healthcare practitioners who are the right fit for them. And that could be a practitioner anywhere in Australia, in a completely different state from where the client is actually sitting. So that's a wonderful experience and a great opportunity for that individual to be able to work through their issues.
Mm. Yeah, and to give you an example, now it seems like the bushfires are a distant memory for us, but that was just almost about 7 or 8 months ago, right? And we had the bushfires, and there was a massive sort of need there. But what we were able to do within 24 hours, we were able to have about 200 appointments a week available on our platform for those people in bushfire affected areas. So that goes to that point around scalability, how quickly we can make access to people who are in need. And that's what the platform is capable of doing based on the community of practitioners that we have and their availability. We can sort of publish that and make it available to different groups, different segments. And so in terms of crisis, in terms of response to different sort of to a pandemic or to other sort of situations that are occurring, we can scale it very quickly and make that availability to meet the surge demand. Which also then presents, quite a lot of opportunities for our practitioners as well.
Yeah, absolutely, and also for members of the Core Plus user community who, there's definitely some mental health practices out there who are super busy, and wait lists as long as 6 months, very busy. The demands placed upon them, and I guess the success of their own marketing practices and client retention and the like has been very strong. But there are also some practices that have either stayed the same or perhaps have had some contraction. And so, for those ones, there's a great opportunity here to actually be able to align with CyberClinic, still retain their private client list and work as little or as much as they would like in cooperation with CyberClinic. So I think it's really key, and an innovation that's come out recently from Core Plus Qusai is it's a co-created practitioner profile validation framework called a Service Registration Assistant, and we have built this in order to provide some credentialing and some validation around practitioners where when a practice is setting up itself or adding new practitioners or removing practitioners, they're able to actually validate against AHPRA if necessary, against the Australian Digital Health Agency. They can do that using proto credentials. They can also do that, validate some addresses that they're operating from or to in the process. And we have some plans to continue to develop that as far as being able to build that profile framework. And that should underpin and support digital health program thinking along the lines of what you've developed here, Qusai. So I thought I'd just share that as well.